The other day, a urologist told me that she stays up to date by checking a website called UpToDate. It's UpToDate.com, and anyone can join and see what information they have. It is free for the first 30 days, so if anyone wants to look at how doctors are staying up to date, they can. And I am checking out what they have on the clitoris. The first thing I did was I searched clitoris. And you can see that the first result that comes up is evaluation of the infant with atypical genitalia. So the first thing that they're worried about is whether or not clitorises are quote unquote too big. The second one is evaluation of premenopausal women with hirsutism. And the first thing they're concerned about, again, is clitoromegaly, where they consider the clitoris too big. So for the record, hirsutism is a medical diagnosis to shame women for having too much body hair. For the record, this is how much body hair I have. A lot. I guess they say, basically doctors are super worried about clitorises being too big, so that is noted in this article on women being too hairy. The ninth result is ovarian hyperthecosis. Again, they're worried about clitoral enlargement. I guess clitoral enlargement is just like a really serious problem to look out for. Like, God forbid your clitoris be too easy to find. 11th result is uncommon congenital adrenal hyperplasia. This is insane. Again, they're talking about clitoromegaly. How many articles can they have on this same topic? 12th result is steroid 5-alpha reductase 2 deficiency. Again, they're talking about clitoromegaly, which can be surgically corrected. Oh, yay. Everyone loves surgery on their clit. The 13th result is diagnosis and treatment of disorders of the androgen receptor. Again, guess what they're worried about? They're worried about virilization and clitoromegaly. Oh, God. The 14th result is, you guessed it, also about clitoral enlargement. The 17th result is also about congenital adrenal hyperplasia, where the clitoris is too large. The 19th result is also about polycystic ovary syndrome, where they again talk about the clitoris being too large. The 20th result also talks about virilization and the clitoris being too goddamn large. The 21st result is again about, clitoromegaly. 22nd, clitoromegaly. 23rd, clitoromegaly. How many articles can possibly mention clitoromegaly? It's like they're obsessed with clitorises being too large. 24th result is about the approach to abnormal uterine bleeding in non-pregnant reproductive age patients. Again, they're worried about clitorises being too large. Like, why? I mean, okay, I get it. I get that these are signs of hyperandrogenism and there may be issues affecting fertility or whatever. Okay, great. But can't they say anything else about the clitoris? We are at the 25th result. There has still been nothing on the anatomy of the clitoris or its contribution to female sexual response and orgasm. Again, we're worried about clitoromegaly. 30th result is on use of androgens and other hormones by athletes. Again, they're worried about clitoromegaly. There still has not been any coverage of clitoral anatomy or mention of the clitoris's contribution to female sexual response. The first result is on diagnosis of classic congenital adrenal hyperplasia. It's amazing how many articles they have on this same topic. The 32nd result is on managing an episode of severe or prolonged uterine bleeding. Again, they talk about clitoromegaly. The 37th result is on clinical manifestations of polycystic ovary syndrome in adults. Again, they talk about clitoromegaly. 39th result also mentions the clitoris in terms of clitoromegaly. So we are 39 results in, and there is still nothing on anatomy of the clitoris or its contribution to female sexual response. Every single article has mentioned clitoromegaly. The 41st result is on female genital cutting. They talk about how in Europe and the United States, removal of the clitoris or prepuce was occasionally performed to treat clitoral enlargement, redundancy, hysteria, lesbianism, and erotomania. Article on female genital cutting, they talk about how reinfibulation is not considered a federal crime. so it may be performed with absorbable sutures in a running fashion if a woman strongly insists upon the procedure. They are endorsing female genital mutilation on women who have just been given birth. It's not illegal in the US. The second result is on etiology, clinical features, and diagnosis of neonatal hypertension. Again, they bring up clitoral enlargement. It's almost like these doctors are obsessed with clitoral enlargement, and it's the only thing they want to talk about as far as the clitoris is concerned. The thing that's gone on is the trans community has gotten the idea that I'm anti-trans. I am not anti-trans. In fact, I really think that trans people deserve adequate medical care, and that includes trans men. Here they suggest clitoroplasty for trans men. What they're doing is they're actually burying the 61st result is the last result, and it is on patient education for congenital adrenal hyperplasia. It also discusses clitoromegaly.